As we age, our bodies experience unexpected and difficult changes. One of the most common and challenging changes is loss of balance. Most people don't think much about it until they lose their balance. But why does it happen? Did you know that persistent balance problems can be linked to certain medications you're currently taking? It's a bit ironic that the things that are supposed to help us can actually increase our risk of falling. What many of the common medications we'll share with you in today's video do is cause a loss of balance. There are dozens of medications that can cause balance problems, but some are much more common than others. Do you or someone you know have balance problems? After watching the video, you'll want to know where you're from in the world. Leave a comment below so we can get to know each other better. Here are 7 medications that can be particularly challenging for you. An unstable blood pressure medication. This is probably the largest category. Almost any medication that lowers your blood pressure can potentially cause dizziness. The logic is pretty simple. If your blood pressure drops too low, especially when you stand up quickly, not enough blood reaches your brain, and as a result, you will feel dizzy or lightheaded. The most common culprits in this category are diuretics or water pills, ACE inhibitors, and beta blockers. Millions of people take these every day, and for most, the benefits far outweigh the risks. This doesn't mean the risks aren't real. If you are taking blood pressure medication and you start to feel dizzy, especially when you stand up, tell your doctor they may need to adjust your dose or switch you to a different medication before continuing. 2. In antidepressants, depression itself can cause balance problems, but so can the medications used to treat it. However, it appears that there are changes in how the brain processes sensory information. Some people describe this as feeling like they are walking on a boat again. For many people, the benefits of these medications far outweigh the risks. Depression is a serious illness, and SSRIs have helped millions of people. But 1, if you're taking antidepressants and you start to lose your balance, it's worth talking to your doctor. 3. Anti-anxiety medications, benzodiazepines, such as Xanax and Ativan, are often prescribed for anxiety. The central nervous system can be great for calming anxiety, but they can also affect your balance and coordination. These medications are particularly risky for older adults. 4. Sleep aids. This category includes both prescription sleeping pills and over-the-counter sleep aids. Most of these work in a similar way to anti-anxiety medications. They depress the central nervous system, which can affect balance and coordination. The risk isn't just while you're sleeping. These medications can make you feel dizzy and unsteady even after you wake up. 5. Antihistamines. Here's a surprise. Allergy pills you buy from the chemist can affect balance for many people. This is particularly true of older antihistamines such as Benadryl. These medications work by blocking histamine, which plays a role in your body's immune response. Histamine also plays a role in regulating wakefulness. 6. Pain medications. This category includes both over-the-counter pain relievers and prescription opioids. The mechanism varies depending on the particular drug, but many pain relievers can cause dizziness or affect coordination. Opioids are particularly risky. They work by binding to opioid receptors in the brain, which can affect balance and coordination, and can also cause drowsiness and impair judgment, further increasing the risk of falls. 7. Diabetes medications. If you have diabetes, you're already at higher risk of having balance problems due to potential nerve damage, but some diabetes medications can further increase this risk. Insulin and other medications that lower blood sugar can sometimes cause it to drop too low. A condition called hypoglycemia can cause dizziness, confusion, and loss of balance.